In the beauty industry, the neck is one of the hardest areas to treat, but it really shows aging. We have a lot of ways to treat the neck, from non-invasive to minimally invasive to surgical options that can help rejuvenate the neck. And that can really take someone back 10, 15 years when we treat the neck surgically. Our non-invasive way of treating the neck is with the venous freeze radiofrequency. That machine is a device that uses radiofrequency, thermal energy, and pulse magnetic fields to tighten the skin and to melt unwanted fat. As you can see here, my esthetician Erica is treating a patient who has a little bit of sagging of the neck, some fullness under the neck, maybe a little bit of fat here, but certainly someone in their 40s, and that's going to help tighten the skin of the neck. It's actually painless. Some people compare this to a hot stone massage, but it's actually thermal energy that's destroying the fat cells and tightening the collagen layer of the neck. The newest thing in our industry is called Kybella. Kybella was recently FDA approved about a month ago, and what it is deoxycholic acid. It's an agent that we inject into the submental fat, just small amounts, and that will actually disrupt the fat cells and cause permanent fat loss in that area. So this is a brand new treatment. It will be made available to plastic surgeons and dermatologists during a rollout in late June and early July in the United States. And it's very exciting because it actually has the potential of reducing submental fullness or an unwanted pocket of fat underneath the chin without any surgery at all. So Botox, as we know it, the cosmetic miracle drug that we can inject into the brow, can also be used in the platysmal bands, or the neck bands that show the early signs of aging in the neck. Now, the platysma is a wide-based muscle, and what you can see here is Kristen, my injection specialist, injecting my own neck muscle with this Botox. And what will happen is in about 3 or 4 days, those neck bands will slow down and not be so hyperactive. And this is just one of those early signs of neck aging that we can treat real elegantly. For people that show more advanced signs of aging in the neck, saggy skin, loose muscle bands, and some fat, we actually can produce wonderful results with a surgical procedure. That involves oftentimes liposuction under the neck combined with a neck lift, or tightening the muscle bands of the neck from the front, and then a facelift or neck lift from the sides. Obviously, that's more for people in their 50s, 60s, early 70s, and that's a surgical procedure that can produce long-term results. You can see me here in the operating room performing a liposuction of the anterior neck on a patient whom I just did surgery on this week. And from the side, you can see me doing a little bit of work as well, liposuctioning the jawline, and then even performing a facelift and neck lift in conjunction with that. And that really reestablished her neckline, which she has not seen in many years, and produced the most long-lasting permanent result. And that's traditionally what surgery can do as compared to other temporary measures which we use in earlier decades of life and for earlier signs of aging.